My name is Dr. Dave Barnhart. Why do I wear a face mask? My daughter is an emergency room doctor who diagnoses patients with COVID. I strongly desire for her job to be less risky. I want to put my arms around my 97-year-old mother, alone in a nursing home. I don't want her to die there without the touch of family members. If I wear a mask, I'm signaling the importance of being considerate of frontline workers. My clients include grocery store and restaurant employees, physicians, nurses, dentists, respiratory therapists, police, military, teachers, pilots, paramedics, mechanics, childcare workers. The clients who work from home, the engineers, physicists, call center workers, government employees, still have to go into public spaces for groceries and health care, sometimes to work. Their physical health is important to their mental health. We need to kick COVID's butt and get it out of here so that we can sustain our healthy support systems. Churches, synagogues, mosques, sports, support groups. If I didn't wear a mask, then I might be responsible for reinforcing a belief that COVID is not a dangerous, communicable disease. If you aren't wearing a mask, I know you're not an infectious disease expert, and I'm not going to convince you to change your mind. You're the product of what you pay attention to, and it's not your fault that you're not open to influence of healthcare professionals. As a mental health professional, I know how hard it is to change your mind. Your social group is your main influencer. If you wore a mask, they might think you're weird, or that you're part of a conspiracy, or that you're not interested in improving the economy. I'm not trying to reach you because your cognitive bias is too ingrained. No, I'm trying to reach those who already wear masks. I'm encouraging you to persevere. You may know people who've had COVID. I do. When you wear a mask, you are signaling that you are loyal to those who serve us. When you wear a mask, you support others like you and me who respect and care for our frontline workers and everybody else, including those who are responsible for putting others at risk. You will not need to feel guilty as we watch the COVID number continue to rise, as we see the results from the recent holiday, and as more businesses open up that don't enforce a face mask policy. You aren't likely to add to the numbers. You have socially distanced and worn a mask, demonstrating that you were reducing the chance that you are spreading COVID. Those that aren't socially distancing and aren't wearing masks, they can bear the guilt, and it will be accurate guilt. They were warned, but they chose to believe a different narrative instead of science. It's not really their fault. They just run with a crowd that values other things. You can try to convince them otherwise, but they will be defensive until somebody they know gets really sick or dies. Then they may experience accurate guilt, although they aren't likely to speak it out loud. You may try to reach out to them, but be prepared. The little dopamine shot you get from the moral relief won't compare with the dopamine shot that strengthens their tightly held cognitive pattern. You are likely to hear a defensive retort. Just walk away silently and keep your mask on. Love them anyhow. You'll be the kind of neighbor we're encouraged to be.